Hi, this is Congressman Steve Israel, and welcome to my website. Right now it's August and we're in district work period. I was one of the members of Congress who urged the congressional leadership not to vote on the health care bill before we had an opportunity to come home, speak to our constituents, really digest and absorb the bill, and I'm glad that the congressional leadership made that decision. Because since I've been home, I've been hearing so many different opinions and lots of questions about this bill. In fact, just today I invited several leaders of the Tea Party movement here to my district office in Hauppauge to hear their questions and try and address some of their concerns. Now, on some things we're going to agree. On other things we're going to disagree. But I think that you would agree with me on the importance of debating this issue based on fact and not some of the myths and some of the scare tactics that we've heard throughout this debate on all sides of this issue. So let me begin with a specific question that came to me. We've received thousands and thousands of questions in our healthcare hotline and lots of emails representing both sides of the issue. I've just selected a few questions that I wanted to answer for you today. A constituent from Comac contacted me and said, I've heard from people like Sarah Palin and Sean Hannity and Rush Limbaugh that health insurance reform means euthanasia for seniors or government death panels. Is that true? No. In fact, talk about death panels and euthanasia for America's greatest generation is just plain wrong. But here's where that interpretation may come from. There's a provision in the current House legislation that would allow Medicare to pay doctors who are providing patients with information about end-of-life decisions and things like power of attorney and related issues. This advice is not mandatory. A doctor does not have to provide it, and patients don't have to listen to it. The idea, ironically, came from a very Republican conservative U.S. Senator from Georgia named Johnny Isakson. And here's what conservative Senator Johnny Isakson said about this. He said, these end-of-life consultations empower you to be able to make decisions at a difficult time rather than having the government making them for you. He said that to the Washington Post. Any other interpretation of the provision, Senator Isakson said, is just plain, quote, nuts. And the head of the AARP, John Rother, called the sense that these voluntary consultations on power of attorney and other legal issues relating that to euthanasia, he said, is a gross and even cruel distortion. Here's another question that came to me from East Northport. Congressman, this bill rations health care, doesn't it? No. In fact, the bill is designed to actually reduce the rationing of health care that currently exists. Here's how health care is currently rationed. Right now, your health insurance company can decide on its own to refuse to pay for treatment, increase your out-of-pocket cost, increase your copays, decide to rescind your policies, or deny you care based on a pre-existing condition. The bill that's currently drafted specifically and explicitly stops insurance companies from rationing your health care. The whole purpose of this bill is to allow you to receive quality medical care without having the private sector ration it. Now, some say, well, that's fair enough. I don't want my insurance company rationing my care, but this bill will allow the government to ration my care. The plain answer is no, it doesn't. There's nothing in this bill that says that the federal government can ration your care. Now, here's where that view may be coming from, and this will be the final answer to this question, and we'll do more in the next several days. The current House bill provides funding for something called comparative effectiveness research. That's simply the study of how well various treatments work for patients. The research does not require that a doctor discontinue certain treatments. It simply advises doctors and patients on how to avoid unnecessary costs and treatments when they have certain situations. But the ultimate decision rests with your doctor and you. And here again there's an irony. President Bush allocated more than $300 million last year alone for comparative effectiveness research. And I didn't hear a single person expressing outrage when President Bush suggested that comparative effectiveness research is a good way to advise doctors on how to avoid skyrocketing costs and treatments when they're uncalled for. There are lots of other questions that have been asked about abortion, about the public option, about whether this will force people out of their health insurance companies onto a government-run health care plan. And I look forward to continuing to answer those questions in the days and weeks ahead. In the meanwhile, I remain satisfied with the decision by the leadership of Congress not to vote on this bill before I did have an opportunity to meet with you, to meet with the folks who came in today from the Tea Party movement, to meet with so many of you on so many different sides of this issue, and at the end of the day try and develop consensus on a very simple paradigm, and that is that if you don't have health insurance, you should be able to get it, and if you do have health insurance, your health insurance company should be forced to provide it. Thanks very much for listening, and please tune into this website and we'll have more questions and answers later.